Welcome to another episode of ShareNet. My name is Ian, and today we're very lucky to have a very special guest, Yan Jun, to join us. She's a speech language pathologist. Let me just share with you. Voila, this is Yan. How are you doing, Yan?
Oh, good. Thank you. Thank you very much for having me here, Ian.
Thank you for coming in today to this recording. We're very lucky to have you. So today's session is all about learning about the SLP, speech language pathologist. Maybe just briefly, for some of us who aren't too familiar with what SLPs are, can you just briefly talk about what they do and who they are?
Yeah, sure. So SLPs, speech language pathologists, we are professionals who help people communicate better, and we help people eat and drink safely. That would be the one sentence answer to your question.
Okay. Yes, we'll go more in depth with what they do and what is the requirement to achieve such a profession. Okay, so first of all, Yan, can you? I've heard of the term SLP, and then there's also ST. Okay, can you explain what SLP and ST, what these acronyms are?
Yeah, sure. So I think when people say SLP, it stands for speech language pathologist, and ST, I guess, is speech therapist. And there are many other different names that people call us. And some of my clients call me speech language teacher. They might even say speech language therapist. There's really no difference, I think, to these names. And to me, I don't really worry too much about what people call me. But I know that the official title here in Canada for our profession is speech language pathologist, so SLP.
I see. Thank you. I guess speech language teacher to me is the easiest to understand. But thank you. It's definitely a fancy name. So tell me about, well, before we go into the details of what you do, but can you tell me the academic requirement or the qualification that you need to become SLP?
Yeah, that's a good question. So to practice in Canada, you will need to have a master's degree in speech language pathology, which means you need to finish your high school and then finish your undergrad and finally enroll in a 2-year to 3-year program of speech language pathology. And here to practice in BC, you need to be registered with the College of Speech and Hearing Health Professionals of BC. It's a long name. So the college, the reason why we need to be registered with the college is that SLP is a regulated profession here in BC, meaning that there are rules and guidelines that are set out for SLPs to follow, and in order to protect the public. So when you hire an SLP, you know that you're being protected, and the SLP who is registered with the college follows all the rules and guidelines set out.
I see. So it's I guess it's really important because you're talking about language. You want to make sure you learn it the right way, and all these guidelines are very important. But thank you for sharing that specific part of the academic requirement for an SLP. Now, regarding your work, your day-to-day work, what type of clients or patients do you provide therapy to?
Yeah, so I think this question is going to require a long answer. So because we work on all areas of communication and feeding and swallowing, which means you might see us working on feeding with very young infants and new moms in the NICU, let's say. So that would be our youngest clients. And you might see us working on speech and language with people affected by different disorders or different syndromes, such as cleft lip and palate syndrome, cleft lip and palate, or Down syndrome, or cerebral palsy. And also you might see us working on speech and language with a person who suffered stroke, because the stroke might have affected their ability to talk and to understand, and we need to help them relearn those skills. You can also see us working on social communication with people with autism or autistic people, depending on how you prefer to say that. And you might see us working on fluency, so helping people talk a little bit more easily with people who stutter.
See.
And lastly, you will see us work on augmentative and alternative communication, so AAC.
Okay.
What that means is that when someone is not able to produce words verbally, then they need another mean to express their thoughts and express their feelings. I think the most famous example that people know is Stephen Hawking. So he has an AAC system, a voice production system, a voice generating device that allows him to share his brilliant thoughts with people, even though he couldn't produce his words verbally. And you might be surprised, actually, there are SLPs working with COVID patients now. So you can see SLPs working on AAC with COVID patients, because when they go on the ventilator, they can't produce sounds verbally. And so some SLPs will introduce a picture communication board so that they can point to different pictures to let people know what they want and what they need. And also after they have recovered from COVID, a lot of them have lost their voice because of the procedure, and an SLP can help them regain their voice.
This range of the age group that you work with, this is huge, because you're literally working with an infant to someone who may be, who suffer from a stroke, maybe a senior.
Mm-hmm.
So you're literally working with all age groups at this point.
Definitely, yes,
Wow,
yeah.
that's
That's the scope of our profession, I would say.
I
Yeah.
see. So in terms of the challenge, it's not just about breaking down the barriers with like the verbal part of the communication. You actually have to work with the different age group, know the individual, and understand the barriers that this person is facing. So this is quite something. Wow.
Yeah, it's a very interesting profession.
Awesome. So let's tell the viewers about how do you work with a person with disability. Maybe you can share a little bit about the details of that step by step.
Yeah, so usually the SLP will adopt a client-centered kind of practice or a family-centered practice. So what that means is that we try to talk to the patient, talk to their family to understand what their priorities are. What do they want to work on? And then based on their priorities, we will identify specific and attainable goals for the family, and will provide them with strategies that will help them achieve their goal. And also we work in collaboration with many other professionals. For example, at BC Center for Ability, where I work now, our early intervention team has occupational therapists, physiotherapists, SLPs, and social workers. We work as a team, and we also work with people outside of our center, such as the childcare staff, infant development program consultants, supported child development consultants, and also very importantly, we work with the child's family. Sometimes it's the parents, sometimes it can be the grandparents, or even a sibling. We try to include everyone who is important in the child's life in this process. And some other professionals that we might work with include audiologists, so they look into people's hearing, and doctors, physicians, nurses, or dietitians, and sometimes psychologists.
Awesome. And earlier you also mentioned that when you create devices like those AACs, right? You probably would be working with some kind of engineering, like the device and the detail and how they work with the person. I guess you work with all levels of the people supporting the person with disability. So this is not an easy job, Yan.
I really like the collaborative approach.
Awesome. Now, I think a lot of people are asking about this. Like, we don't hear about SLPs a lot. Like, you just don't go to a store and say, hey, can I talk to an SLP? No, this is not the type of profession that you can just find anywhere. So how exactly, Yan, do we find a SLP here in Vancouver or Richmond?
Yeah, that's a very good question. So there are publicly funded programs. And for example, if you're looking into early intervention, meaning you have a child who is younger than school age, younger than the age of 5, then there are early intervention programs such as BC Center for Ability. So these are community-based centers. Or you can go to your health unit, and your health unit should have speech-language pathologists working there as well. You can also find SLPs in schools. Once your child enters a school, you can talk to your teacher. Usually, teacher will be the best access point when you're in school. So talk to your teacher about your concerns, and maybe ask your teacher to make a referral to the school SLP. And also there are SLPs working in hospitals, working in rehabilitation centers, depending on what a person needs.
Awesome.
And finally, in addition to those publicly funded programs, you might want to look for a private speech-language pathologist. So if you are looking for one, then you can use Google, of course, and Google Speech Language Audiology Canada or Speech and Hearing BC. From there, you can see they have a website that allows you to find a professional. And you can narrow down the search by adding filters. For example, you might even be able to say, okay, I really want an SLP who speaks Mandarin. So you can put that in as a filter, and then you can find all the SLPs who speak Mandarin. Or you want to find an SLP who specializes in one area, such as aphasia, then you can put that in as well.
Awesome, Yan. Now, I'm just curious. I guess this next question is more for the parents out there. Mm-hmm. So at what point will the parents need to contact or look for SLP regarding the kids? Like, what are the signs that they should look out for when they need like extra help, when the kids need extra help in terms of speech and this kind of help that you provide?
Yeah, that's a very good question. So I usually go by, 1, 2, 3s. So it's a little bit simplified, but I feel like it works. It's easy to remember. So 1, meaning by the age of 1, you will want to see your child using single words. So 1-word sentences. And they will be able to follow very simple 1-step directions. So you can tell them, sit down, come here, and they should be able to do it. And then 2, by the age of 2, usually they're able to at least put 2 words together. So they might say, Mama, come, or puppy, jump, or bunny, hop. So they might be putting 2 words together by the age of 2, and they will start to follow a 2-step direction, such as, pick up the garbage and put it in the garbage can. And then 3, so by the age of 3, you will want to see your child producing at least 3-word sentences, and you might try to give them 3-step directions. So if your child are not meeting these milestones, then you might want to contact an SLP. Or if you see some other signs of your child doesn't play the same way as other kids, or your child doesn't really socialize with you with other kids very well, those are the reasons to contact an SLP as well.
I see. Thank you. Wow, I like these rules, simple to remember. Just can't imagine what it's like when you reach the age of 30. That's a lot of instructions by then. Okay, Yan, thanks for joining us today. I think this is all the time we have for now. And folks, remember to like and subscribe our channel. And if you have any topics that you're interested, please leave us a comment. And we'll try our best to arrange guest speaker who can talk about that topic. But for now, thank you for joining us and goodbye.
Thank you.